Hey, Dr. Bramah.
Hey, it's Jake, isn't it?
Yeah, this is Jake, and
I'm Grady.
Nice to meet you both.
Nice to meet you.
yes, first off, thank you. Well, let me make sure we're recording here. Oh, we are perfect.
Yeah, you've set it automatically to do that, yeah.
Awesome. Let's go. Well, thank you so much for taking the time out of what I know is probably a busy schedule just to kind of like talk with us and let us pick your brain a little bit.
Yeah, no worries. Where are you guys based? What hour is this for you?
10 a.m.
Oh, okay, it's not too bad then. It's all right. Yeah.
Yeah, so
Yeah.
we're in Ohio if you're familiar with the
Yeah,
states.
yeah, yeah.
Okay.
I have family who live in so
Okay.
yeah.
Cool. Yes.
So,
All right.
so
So our project is really we're kind of supposed to just interview somebody who's kind of in the field with running and kind of like progress in the field and like doing research kind of like you are. So it's kind of just going to be open-ended questions, I guess.
yeah.
So I guess just to start, if you wanted, we can kind of talk about like you could tell us your background and your education and kind of like how you got to where you are in this point.
Okay. Yeah. So my background, I'll give it you related to running as well. So I'll try and tie those pieces together. I guess as a youngster, so from probably about the age of 13 years old, I was a track athlete. I predominantly ran 400 meters. Trained in a group with quite a lot of different international based athletes, some of them running like 44 seconds for 400. So one of my ambitions growing up was obviously to be a 400-meter runner. Sadly, injuries and also just not knowing as much as I do now meant that I was just never good enough. So I switched my focus to went on to study physiotherapy. Did a master's degree after studying physio, and then did a PhD. My PhD was in running biomechanics. From graduating, I started my work in rugby league and then moved to work in track and field. So I started working as a physio with Team GB from 2014 onwards. Worked with like range of athletes from sprinters to long distances that were all part of the funded program, or what they called the World Class Performance Program. And kind of switched my focus from being an individual athlete in a team to being a physio within a team. And my research at the same time was then on running biomechanics. So I messed around with 3D motion capture from a research sense. Started that in 2009 and basically kind of grew my research around trying to understand movement from both a performance and injury context and generate income by delivering assessments and consultancy-based assessments in biomechanics for anything from Olympic athletes, recreational athletes to footballers as well. So my research is, yeah, focused on running biomechanics, and primarily what I care about is, I guess, the clinical application. So how we can inform practice of understanding biomechanics. So that's like I guess, a one-stop shop to my history.
Okay. Okay. And how soon? So when did you start? In 2014, was that when you really started studying biomechanics and became more of a biomechanic, like switched from physio to research in biomechanics?
Yeah, so when part of the reason why I wanted to study physio anyway was because when I went on open days, I saw like motion capture systems in play, and that were marketed towards the physio program. So I was really then interested in how our understanding of human movement could then be used from a injury-based context. And the same as when I was an athlete actually training, one of my training partners used to go out and spend time with Dan Paff over in Phoenix when he was there at the time. So would come back with teaching us all new drills and movement-based proficiencies. So I got quite obsessed with that, and actually that's the why I went on to study physio. Then in 2000, so I started studying physio, and there was some researchers at the uni looking at biomechanics. So I actually started working with them in 2010. And basically what we were doing was collecting data on runners, endurance runners at the time, and trying to make sense of it and apply it back to people. So at the beginning, I remember when we were looking at data and trying to feed back to athletes on what they need to do, I actually don't think we really understood what we were looking at or doing. We were just trying to make, I guess, informed guesses. So 2010 was when I started that. And I'd always have this blend of not only was my data being collected for me to research, but also at the same time, everyone who came in through the door, we were trying to give them some form of applied aspect of it. So by pretty much there and then going, yeah, this is what we're seeing. This is what it means for you from either a performance or injury context. This is what you should do. So started playing around with it in 2010. In 2013, we launched it as an actual service people could buy into, and we still run that to this day. And it was, I guess, 2014. I was then working as a physio with Team GB, but still also doing this research at the same time, and I guess the applied aspects of it at the same time.
Okay. Okay, cool. So did you initially start with the motion capture with like distance, like mid distance, and then and just recently, kind of with the development of the SMAS, like move into more like sprint mechanic assessment?
Yeah, so when we started doing biomechanics, it was in distance. Obviously,
Mhm.
my personal background was sprint, and I guess what I was quite keen on was applying sprint-based movement principles to endurance runners, because
Okay.
my view and concept at the time was that to win the 100 meters, it's all about how well you execute that race and how well your form is carried out, right? And I think in 100 meters, every hundredth of a second counts. And therefore, how you apply force, the direction you apply force in, all relates to that final outcome of winning or losing. In my head, then I was like watching endurance runners thinking, guys, these people really aren't appreciating how much mechanics can have a big play in their performance. Take it from a marathon, right? The amount of steps that they're taking, and if they can buy themselves a hundredth of a second over each step that they take, that equates to minutes over a marathon. It's like that's massive. So, and at the same time, there's no funding for research. So we knew that the mass market was sell biomechanics to endurance runners to generate money. Somewhere along the way, probably about 2016, football clubs started realizing I was doing this and then asking me to look at players sprint and move. So we were looking at football players and certain sprinters that I'd work with at that same time. And so I guess from 2016, we've been having a database of sprinters from 3D motion capture and 2D. And then 2020, COVID hit, we redid the lab. Trying to set up the lab from a motion capture sense was driving me mental, and I starting to realize all the flaws motion capture systems has. So at that time, I was like, man, we really need a way of assessing people in field, which is what then directed to me towards the SMAS, because I just got so disillusioned with 3D, thinking, yeah, it's
Mhm.
great, but it's got so many, now I can see all its flaws. We need to go back to how we actually just look at this in field.
Okay. Okay, cool.
Um, so I guess one of the main things we kind of wanted to touch on was we learned about in our running class the SMAS. We kind of went over it like in our sprinting like module. So you kind of touched on it a little bit, but could you just go a little more into like how you came about to find the need for the SMAS, and then kind of what your thought was into putting in like the sections, like each section, into why those are included and some maybe others aren't.
Yeah. So in terms of the need for the SMAS, first of all, was I've always had a thing of, obviously I love sprint and I love watching sprinters move. And whenever I looked at team-based sports, or clubs would come and ask me to assess team-based sports, and with the question of why are we getting recurrent injuries in this player every time they sprint, my view was that they just move completely different, and I don't mean this to sound offensive, but they don't really know how to move well from a sprint-based context. So straight away, already I had this like hypothesis that footballers just can't run well. And I jokingly say at conferences, I jokingly open conferences and say, my background is track and field. So based on my biases, I'm here today to tell you that footballers can't run. Um, uh,
It's too big and bulky.
yeah, yeah. So anyway, a couple of clubs I was working with at the time as well from all over the UK were basically saying, 3D motion capture is great, but we can't bring every single player to see you. So how can we screen players in club on a regular basis to identify those who we think movement might be a risk? So that created the need. Then I was like, right, there's got to be a way we can look at things from a 2D perspective, quite easy and simple. And what I had seen as various other movement profiling scores along the way around single leg landing, where they sum up or add up the amount of poor quality technical features an individual has to make a composite score. So the idea then was like, right, can we create a qualitative score which rates your overall movement quality? With the higher scores you get, similar to the landing type scores where it's just the worst quality movement, and the lower scores, the better quality. So we can start to just get an identification of who do we need to intervene with here in movement, who do we not? So then the question was, right, well, what parameters do we want to put in and how do we develop the actual score? So my connotation at the time was directing this primarily to hamstring injuries. So its underpinning development is for hamstring injuries. And what we did was we basically went through the literature to kind of go, what do coaches think are important from a biomechanical standpoint? And Rudy Klemmer did a brilliant qualitative work years ago now, where he interviewed coaches and basically got details of what parameters they thought were important for hamstring injury risk. So we started by taking all of those parameters and then looked at, well, which ones of these parameters have any evidence to support them scientifically, either from a study that shows they lead to injury development or from a modeling-based study that shows it will change the stress or strain applied to the hamstring tissue. If it had any of those things, we took that parameter through and we're like, okay, this is going to go into the final score. Then once we had got this preliminary list of scores, I met with a few different coaches and practitioners working in track and field and football to ask them, right, what do you think of these parameters? Do you agree? Do you disagree? Are there any that we've missed? And that developed the final score, really. There was a few parameters that other coaches felt like we had missed and should have included, but why they then were not kept through were because A, we couldn't find any literature to actually support them in an academic sense, and B, even then their assessment would become very challenging to visually spot. So that gave us the 12 score items that we put in there for the overall score. We've since worked the reliability of it, so we know the reliability of the individual scores and the overall score itself. There are also some reflections that I kind of have learned from that reliability process of how you make it better. And what we have then since done is look at whether or not the score can prospectively or is prospectively associated with future hamstring injury development, which it is. And that paper is in hopefully final round of revisions. What we don't know, and we actually haven't looked at, is whether or not higher or better scoring people, so lower scores, are associated with better performance or better sprint times. Now, you can't really like take this as gospel. I think I did that on the data and found that it seems to be that faster athletes had better scores, but I can't remember that. So don't quote me on that. That's a study that needs doing.
Yeah, a lot of good things, and then that was kind of something I had thought about too, because in the original SMAS study where you assessed like kind of the inner rate of reliability, you assessed elite athletes, and based
Yep.
on the score, some of these elite athletes kind of like they scored poorly, and some of them scored great. So my question was like, wow, like as if once you improve this, it reduces your injury risk, but does it kind of predict whether they're going to perform better or not?
Yeah. So firstly, we don't know if it's going
Uh-huh.
to improve the performance. But if I go a step back and take a pill on that word of elite athletes, it depends what you define as elite athletes, right? These are elite football players, so they are or elite soccer players, right? So they are performing they're making far more money than any of us are. They're performing at a high level of professional football. They're full time. That's what they do, ranging from Premier League down to National League. So yeah, in that sense, they're elite athletes. But in the sense of 100-meter track and field, they would probably not be the same level of standard. I think the average, we had a mix of people who could only hit around 7.9 meters per second for max speed, and others that could hit like 10.2 meters per second. Now, one of the anecdotal things that like I kind of learned from when I started trialing it out on myself is if I assess myself sprint, I think I score 0. And if you take most 100-meter sprinters that are capable of running 10 seconds, they will pretty much score, they won't score above the mean average of 4. So you take Shelly Ann Fraser-Price as a female, and I think she'll score 2 on the score. So in terms of that reliability study where I benchmark people into normatives, I do not expect, I hypothesize that you will not find any elite sprinter scoring above 4 out of 12, which is good, because then that's kind of saying their movement qualities are what you want them to be. So with that in mind, I kind of feel like then theoretically, I would hypothesize that if you took team-based athletes, improved their movement qualities, and took them from like a 6 out of 12 down to a 2 out of 12, I'd hypothesize that they should run faster. But I don't know.
Yeah, I would agree. And I thought too. So I played American football, so obviously in like American football and like rugby and like kind of sports related like that, like injury is so high.
Yeah.
And my thought was always like, well, the best ability is availability. So
Yeah.
any way you can stay on the field, is going to improve your performance. So anything to reduce risk of injury, like that's going to improve your performance. Just kind of like, I guess, just like my subjective thoughts, like after that.
Yeah.
No,
Yeah.
I agree. I agree. I think things, I think if we improve people and make them faster, we should also make them more robust athletes. It's one of the studies that I really want to do. Is whether or not I find the time to fit it in. In my head, I'm teeing it up for next summer, but whether or not I've got a lot of projects on the go, so whether or not I do find the time to deliver that is a different matter. But what I mean, even if we look at like Yoda Mendeguchi, right? He's done some nice work doing 3D mechanics and changing soccer players' sprint technique, and within his studies, he kind of showed that they changed anterior pelvic tilt and other features that are on the SMAS, and performance improved. So, it makes sense. And the big thing for me was kind of going, look, injuries are multifactorial, so sometimes it might not just be movement that causes injury, but at least that scoring system would give us a way of going, look, this person really does, excuse my language, but this person really does move like shit. So perhaps they would benefit from us targeting those mechanics.
Mm-hmm. Yep.
One thing that kind of caught my ear was you were saying that, like with the reliability, like for each individual measure. So could you talk about, is there like certain ones that are more related or more academically like backed up compared to others?
In
Like
terms of
that
links
can
to
cause,
injury,
yeah, to cause injury.
yeah. So this is a challenging one because you've got because there's a lot of work that's not been done. So of the work that has been done, things like anterior pelvic tilt is perhaps your most strongest association to future injury development. After that, your second strongest one is probably the trunk rotation. But that's indirectly associated with injury based on modeling studies that have shown, or not just modeling studies, some other studies that have shown altered muscle activity of the obliques relate to future hamstring injury. So what we're assuming from that is altered muscle activity of obliques means you can't control trunk rotational positions, and therefore that's linked to injury. Modeling studies would also support that. So so your ones around lumbar pelvic control, anterior pelvic tilt, trunk rotational control are, I guess, your big ones. Then your other ones, like backside mechanics, your thigh separation angles, and your overstride. Now, no one's looked at them in relation to future injury development, so that's primarily why we could go they're not well supported. But from a theoretical sense and a modeling sense, if backside mechanics, big thigh separation angles increases length changes of your hip flexors, which increases the torque around the pelvis and the strain applied to the lead leg hamstring. So Elizabeth Chulnoff's work has shown that quite well, that I think the iliopsoas or force from the iliopsoas can increase hamstring tissue strains by about 12 millimeters. So it supports that theory. And the same overstride mechanics, no one's investigated it, but we know that as soon as you overstride, hip extensor moments go through the roof. So the mechanical demand on the hip extensors, therefore hamstrings, goes through the roof. And in our prospective work, the bit that you won't read, because it won't ever come out unless someone asks me, like you have done, is that what we did was we looked at which individual parameters were most strongly associated with injuries from the SMAS, and they were the parameters of thigh separation angle at touchdown, and your overstride parameters were those that were most were significantly and strongly associated with players who went on to get injured. So, I'd say all of them are important. It just depends on which level of the evidence you want to operate by. The prospective studies, which would say lumbar pelvic control, the theoretical studies, which would say backside mechanics and overstride, and our work, which is not going to get published because I've not written it in the publication, which is the thigh separation angles and touchdown and overstride mechanics were most associated with injury.
Okay.
So I guess the big thing that kind of sparks my head, like from a therapeutic sense and like treating athletes that maybe are going to have bad scores on the SMAS is kind of like, I guess your ideas for like how do you correct these things, like as a therapist, and kind of if like we're better off to maybe send them to somebody who's like a movement specialist or a biomechanist. So I guess could you like maybe provide some examples about how you correct things, like maybe from a therapeutic sense, like with patients coming in that might have bad scores on the SMAS?
Yeah. So I really don't want you to have to send people elsewhere. Like my whole point in the score was, to try and improve people's coach's eye, first of all, and to try and help break down like where you want to target interventions towards. So when I'm trying to address mechanics with anybody, I go through a kind of a 3-step or stage process, and I would address any of these things symbiotically, which is the first one, right? Is addressing physical qualities associated with the movement. So what I mean by that is, say for example, we take somebody with poor lumbar pelvic control, or the lumbar pelvic control subfeatures on the SMAS. Physical qualities that directly underpin your ability to control that spine and pelvis will include range of movement at your hip, so how much hip extension you've got, how much hip flexion you've got, and how much hip rotation you've got. The same at the thoracic spine, so how much thoracic extension and rotation you've got. If they're compromised, that automatically you will start to rotate through the spine more because you're trying to buy yourself more available range to move. So that's really easy then. It's like mobility-based warm-ups. Get thoracic spine moving, get hips moving. My second physical quality around that would be actually, do you have sufficient abdominal strength to be able to control the movement? Which is dead easy. It's like, let's just smash the abs from a training sense. Now, the thing is, it doesn't just stop there, because what we find is I've seen loads of people who have most amazing physical qualities but can't integrate them into movement. And we do know from evidence that most often strength-based interventions alone do not translate into movement outcomes. So we have to coach the movement. Now, the 2 layers for me coaching movement can either be where I would integrate dynamic control-based activities into gym-based routines, or integrate them and cue them directly in the movement. So gym-based routines around lumbar pelvic control might be, how do I challenge your ability to dynamically stabilize the pelvis? So I think I gave Sportsmith some videos that I'd use of like drills with bands, or step ups with a band pulling you in one direction. So you might go from like into a quick step up with a Pallof press of a band, or even like just with weight, quick step up into power press, anything that then challenges your ability to stick and control perturbations. That's what I'd put in the gym. So this is then like layers for me. So then I go, right, okay, this person's got no range at the hips, no range at the thoracic spine. You're coming into the gym, your mobility-based warm-up, and then main gym session at the end, I'm going to challenge some dynamic trunk control exercises, and let's work that. And then the one that's most effective is just coaching it out on the field. And for things like lumbar pelvic control, I've come all the way back around to using drills and then integrating them into run. I moved away from drills years ago because I thought they don't do anything, but now actually I've come back to that whole thing of, oh yeah, they do work if coached effectively. And lumbar pelvic control is simple. It's like I just go restrict their arm movements, so either hold a dowel over the head or a med ball in front of them, and ask them to do various like A series drills or A switch drills, get that feeling of like, so I had this one person I did the other day. I've got videos where I immediately changed them, and I didn't cue the movement at all. I literally gave them med ball, taught them how to do like a switch based drill, and got them to do a switch based drill with the cue, keep the med ball still, move forward, and then took them into a dribble and went, right, here's the dribble, keep the med ball still, move forward. And then I said, right, what do you feel when you do that? And they go, oh, I really feel like I'm having to work my control around here and it's really engaging my muscle. So I was like, okay, great. Take that same feeling and bring it into a run for me now. So then you work it into the run. And if they can't bring it into the run straight away, I'd go, okay, right, let's put the med ball back in. Now, same principle, keep the med ball still, move it forward and get them to run. So I'm basically breaking down the task of challenging them to control and gradually layering it back into the movement. And so that's lumbar pelvic control. And then for backside mechanics, I think switch-based drills are the one for me. If you can teach somebody how to do an A switch and move forward and just pop the trailing thigh through, that works amazing. And then taking that into like bleed-based drills. So I might go into like a dribble bleed. Or then I might just go really to like cues and just go video, like, look at your thigh right out the back. Okay, get that thigh through. The moment that foot leaves the ground, pop the knee forward. And that I find works quite effective. And then overstride wicket runs, like providing they have got for an overstride, if I go back to physical qualities, they've got to have good reactive strength qualities. If they can't bounce off the ground, they will overreach and spend too long overstriding. So you've got to teach them how to bounce off the ground first, and then wicket runs are great to cue them to get the foot underneath the mass. So I actually don't. So I don't know if that sounded complicated, but I don't, in my head, I don't think that's that complicated. I think that's like just really quite simple and effective coaching. I changes people quite quickly.
Mm-hmm. Yeah. No, I can definitely see kind of like your line of thought, like starting in the gym with some of those weaknesses, and then also obviously integrating like coaching. It's so funny you said that because we were just talking in our last class about how strength alone. We were talking more um, in a long distance sense of
Yeah.
how like a lot of times like strength training alone, like you might see someone like they're crossing over, they're overstriding, they have lateral hip pain like that. Maybe strengthening their abduction is not gonna correct it alone. Like you have to cue it. You know, sometimes putting a mirror in front of them, giving video feedback. So it's cool to hear you say like the same thing, kind of like hammering the subject home to us.
Yeah,
Um,
I think strength is like it's a prerequisite for movement. You need a degree of strength to be able to
mhm,
execute a movement, but it does not. I spent years early on. That was what I was doing back in 2010. Like I was looking at people move and going, "Oh, I just need to stretch this out and strengthen this," and it did not change anything. And then I
mhm,
just started going, right, cue the movement directly, and then you start going, "Oh shit, I'm getting really big changes." Um,
mhm,
and then I actually went back to drills, like thinking because I came away from drills thinking you just got to coach the movement. But I feel like you just coach the movement, it can sometimes just be a little bit wooden, especially at the beginning. It's quite then becomes quite rigid in its movement patterns. So I really liked the use of drills again because I felt it developed movement competencies in that part practice form. So as they got more skill at the drill, the movement pattern actually also became a bit more fluid and less rigid and wooden in its I guess quality.
mhm. Now, some of the drills you talked about, the wicket drill, that's the
Yeah,
one where you have hurdles and you have to really put your foot down and bring it back up to like really emphasize like cadence and also keep you from overstriding and striking under your foot, right?
Yep.
Now the A switch drill, you said that I think you had mentioned the A switch and then the bleed.
Yeah,
What's
yeah,
it?
yeah.
Well, now
So
what are those specifically? And it might be we might have seen them. It might just be a kind of a semantic
yeah,
thing.
you will have, you should have seen them, I think. So A switch, like okay, so you start in that position. This is supposed to be my legs, by the way. I don't know if that comes well.
Yeah.
So this you started that position, and the switch is basically, I can't really do that very well. Trying to switch positions as quick as possible. So you basically cue them to drive the trailing leg thigh up really quick, and then they do
Okay.
it in a hop format.
Yep.
So you'll have seen like an A skip where
Mhm.
it's one leg up, one leg down. It's the same thing, but focusing on the switch, so the trailing leg coming through first.
Okay.
Um, I've put videos of them on my YouTube channel, actually, my clinical YouTube channel. So
Okay.
if you literally Googled extra mile health A switch, I think I've got the switch drill on there. And then bleed based drills I use with dribbles. So you've come across dribbles, yeah?
Hmm.
And
It's like
bleed.
dribbles like in soccer, correct?
No, no, no. Like ankle
Okay.
dribbles is in sprint drill.
Oh, okay, okay. That's the one where like you're taking almost short, like quick, really short strides.
Yeah, 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 yeah.
Yes, yes.
Yeah.
Okay. I was way off right
That's quite
there.
hard. That's quite hard for people to pick up, right? Because they just end up taking quick, short strides. What you're really trying to emphasize is that closing down of that recovery leg, so that knee and calf really like flexion. So you're trying to
Okay, yeah.
really emphasize like that position.
Yeah.
Um, so dribbles, I use them and then get them to like, so they get in that cyclical movement of the trailing leg popping through first of all, and once they get it and they're moving forward, bleed is basically just transition that into a run. So try and
Hmm.
just make that color run or that movement run into the run. So what you don't want to see is them start with the dribble based drill, and then when they go into the run, it looked like they've stopped and then gone into a run. It's like I don't want to see any difference. I want to see that drill completely merge into the run.
Okay.
That's what I term by bleeding, and I use that with your dribble based drills, um, especially when trying to challenge like lumbar pelvic control too. So like med ball based runs. So I might go med ball dribbles, bleed that into a run. So take it through,
Okay.
build it, build it, build it, make it look like the run.
Okay. Cool. Now, will you ever like say so you kind of bleed it into the run? Will you ever just slow their sprint down, like hey, like do like a 60% and really focus on your mechanics and like use that as a drill too?
Yeah, I mean, I don't ever particularly cue it as a percentage. I would just I might just say like, okay, let's stride this through and try and
Okay.
focus on this.
Okay.
I've never really cued it from an effort percentage. I just go focus on the movement, right? Like take that
Mhm.
through into a run. Let's go through it into a stride.
Okay.
Um, yeah, I've never particularly gone given them a set percentage.
Yeah. And that was kind of just like an example. Like it's like given a percentage is so subjective. It's like it's the same thing. It's like okay, like slow it down right here and then just focus on your mechanics.
Yeah, I mean they
Yeah.
probably are slowing it down when I'm doing that. I've just never actually
Mhm.
thought about slow it down. I mean maybe one instance where I've actually had to tell someone, mate, just back off a bit. Let's just get the form right first.
Okay.
There's only one instance I can think of where I've done that, and those were the words I used, back off a bit. Um, but normally, I guess, like in the essence of focusing on the movement, they are probably slowing it down.
Okay. Okay, cool. So we're at about 34 minutes right now. How much time? I just want to make sure we respect your time and don't go over. When do you have till?
You've got you are the last person in my day, so you have got whatever time you want.
Okay, awesome. Perfect. Yeah, anything?
Um, so I guess maybe the next thing was you kind of talked about how you've worked a little bit with the perspective, like studies with SMAS. So
Yeah.
kind of, I know you're probably going through like the publication process, but do you have like insight into what you kind of want to do next after seeing like the data you've got back from what you've like completed so far?
Yeah, so there's quite a few layers of what I'd like to do. So the prospective study shows that there are associations between your scores on the SMAS and future injury development. And in particular, like the cutoff threshold is scoring 6 or above. So if you score 6 or above, incidence rate ratios are 2.8. So that's kind of inferring you are, I guess, 2.8 times more likely to sustain a future hamstring injury if you score 6 or above compared to below 6. So we've got that like nice association there. Now there's loads of elements, right? The first one is that we now need to go, okay, can we use simple interventions to improve movement quality and retain that over a long period of time? So that's one in my head that I think like I'd like to tee up for the summer. And the other sort of question then is a really robust science one, which basically is to be able to turn around and say with sure fact mechanics are a risk factor for future injury. You need to show that if you change mechanics, you reduce injury rates. So the really robust thing to do next would be take a massive group of players, randomize them into those who receive movement-based interventions and those who don't, and see if you A, change movement, and B, reduce injury rates in the group that have got the movement changes. Now, that's what needs to be done, and I'd love to do that. The problem with that is the sheer volume of people that you need to do that is probably going to be at least 200 players. So that's not going to happen anytime soon for me to do. What we are trying to work on, though, is we're trying to work on, I guess, a repeat of the prospective study, but including a bit more of a multifactorial screening element. So looking at other physical qualities that might underpin some aspects of the movement too, and seeing if that combined with movement screening, so if we go movement, strength, range, as an example, does that help us predict those at future injury development? And we're sort of proposing that as a multi-center trial. So with a couple of colleagues from different areas in Europe, with looking at trying to get that one going. So that's where I'd like to do it. And then there's like spin-off easy studies, which I think would be nice. Like if you guys want to take them up, I'm happy for that, which is looking at things like actually do people with better SMAS scores run faster than those with lower SMAS scores? Because again, I've written this all around links to hamstring, but I think it'd be nice if it also had any form of links to performance, because from a performance coaching perspective, it would give us a bit more weight to say, hey, yeah, I want to screen, especially young kids, with this to optimize their movement. So there's loads. Just I face the challenges of academia, which include funding and time commitments.
Yeah, and finding finding subjects.
Yeah, well, you know what? This is like a big problem, is that now that people read the work, everybody who wants to be involved wants to make a change. So having control groups where there's no change is becoming increasingly difficult because everybody's implementing some form of intervention. And also the world, the world is a little bit fickle in terms of recruitment. I remember at the beginning, people didn't want to get involved in the project when I started it. Then I presented the preliminary findings at a conference, and all of a sudden, everybody wanted to me to come and show them what I'm doing in their clubs. So, yeah.
Another thing was, so we kind of interacted. You talked a little bit about it in a podcast you did on the Pacey podcast with the My Jump Lab.
Yeah.
So is that pretty like reliable, like in the way that it scores through that app?
So I've never looked at the reliability. So the academic scientist in me says I don't know. But the way that the app works is exactly how it works without the app anyway. It basically, you identify the frame that's associated with the time point, and it gives you the cue and asks you like, okay, is the knee behind the glute, for example. So if used effectively, I think it's probably pretty reliable. But from a tips perspective of how I made this more reliable anyway, was I get it on my computer screen, and I get like a card, usually like my work card is always the one that I use. So you got like my work badge, and for things like thigh separation, and you're asking, is the knee behind the glute? Get the frame right, and then I'll just pop the card on the screen where the edge of the glute, and then I can see, oh, the knee's behind the glute. Yeah, score. And the same with overstride. It's like I'll pop the card on the malleoli and go, is the malleolus above in front of the knee? Oh yeah, fine. So that worked really well when we did the reliability. And then to improve the reliability, again, unpublished stuff, the papers that I wrote were based on assessing one trial per person. I went back and had a look at the data if I just averaged both legs, right and left, or 2 trials. And if I average the scores from 2 trials, it makes the reliability better. And again, it actually makes the prospective study result stronger.
Okay, that's pretty cool.
So I guess if you're going to use it, I'd say averaging across multiple trials definitely works to make your reliability better. My analogy that I used for this whole score was you try to identify if someone moves, like, again, you excuse my language, but you try to identify if someone moves like shit. So the more features that you see, the more you go, knee behind the glute, anterior pelvic tilt, overstride. You start going, oh, okay, this is looking worse and worse and worse. And the same as then if you did another trial and you go, oh yeah, they're still doing it. And then you did a trial and go, oh yeah, they're still doing it. So it goes to a quote I always steal, which is, if it sounds like a duck, if it walks like a duck, and it looks like a duck, it's probably a duck. So the more times you see like inefficiencies and the more inefficiencies you see, the more confident you can become that, yeah, this person does not know how to run.
Now with that app, so like that app it's pretty accessible, like, and it's
Yep.
pretty easy to use for just about anybody.
Yep.
It's kind of your plan for the tool, like anybody be able to use it all the way from like the running expert down to like, your high school track coach.
Yep. Yep. I'm not look, I'm an academic. I'm not going to make millions from the SMAS, so it's fair game. It's public domain now. The idea was really to help people develop a coach's eye and to try and impact and influence the people that they work with. I guess from an academic sense, if we can show that it identifies injury and can have a meaningful impact on people's practice, that is really powerful for what we want. I mean, I'm not in this game from a financial perspective, more from advancing knowledge and how we positively influence people. So yeah, it's I guess what's going to happen is, right, your real top end elite 100-meter sprint coaches will not really use it because they'll have developed and refined their own coach's eye and their own things they look at over years and years that are not necessarily science based, but off their experience. This is more about how can anybody and any of us look at look at movement, sorry, and become more confident in what we're looking at.
Okay. Now, what are some things, or there might be a lot. It's like, what are some of the big things that you can't necessarily assess with the SMAS that you were able to assess like in the 3D capture?
Yeah, so 3D capture will allow us to actually quantify force output for one. So we'll be able to actually see if there's any deficits around hip extensor force production, the total work that's done, which is the work that's done at a joint is going to be influenced by the joint moment and the rate of change in the angular position. So I guess the angular velocities, the horizontal force that they apply. We can then see if there's any deficits around the knee or the ankle that might be contributing. We can then also look at rotational patterns. So we can quantify like pelvis rotation, and we can quantify like lower limb external or internal rotation. Because I do think there are like some theoretical links between the transverse plane rotation of the knee or the shank and how that might influence tissue strains. So whether, it's a bit difficult to say exactly how, but for example, if you take an externally rotated tibia, what we do know is that will reduce the moment arm at the knee for the semitendinosis and semimembranosis, which will perhaps make it more difficult for them to assist the biceps femoris. So it could lead to either overload of the semi-men and semi-10 because they're having to contract harder, or overload of the biceps femoris because it's preferentially recruited. So 3D allows us to see things like that, where we might then go, oh, okay, actually, that's bit beyond what we'd expect from the norm. So maybe it's worth us trying to work or put interventions in place to change that positioning. And one of the things we do see 3D wise time and time again post recurrent hamstring injuries is deficits in force, or I guess power production from terminal swing of hip extensors. So we find that the actual hip extensor power production of positive work done is lower in previously injured players than it is in uninjured players, which is probably suggesting that we've got some deficits from a rehab context in the movement that we don't see with our eye that haven't been fully addressed. So it kind of just gives us more of that holistic movement and holistic force assessment, but largely down to a qualitative interpretation of like, well, what does that mean and what do we do about it? But that is just something that I guess I've done for many, many years.
Okay. Going back to what you said about just a minute ago, you found that hip extensor so after injury. And when you say after injury, do you specifically mean like hamstring injuries?
Yeah, yeah.
So my question is, so because I pulled my hamstring a couple of times.
Yeah.
And my thought too is that like when you are returning to sport, and in my case, like just personally, there were definitely times during my rehab where, because especially like obviously the re-injury rate for hamstrings is super high.
Yeah.
Is like almost like kind of the fear aspect of it. You know, you injure it
Yeah.
once, you injure it twice. So have you ever like talked to athletes or screened athletes for like fear avoidance, or like are you fearful of really pushing it to top end speed, or no?
Yeah, we've not done that. I mean, that's something that we've recently integrated into all our 3D testing, is that people fill in fear avoidance belief questionnaires and Tampa scale for kinesiophobia, because I do think that element to play. And I actually
Mm-hmm.
think that element should be addressed throughout our rehab process. And I mean, I come from a track and field based background, right? So one of the things that I think we do different to team sports, or in a lot of team sport cases, is we try to train movement very early, which I actually think builds confidence in your ability to I guess move the limb at high velocities, for one.
Mm-hmm.
And number two, I actually think conditions the muscular-tendinous junction better than slow-based gym exercises. And I think what goes wrong in a lot of team sport settings is we see a hammy injury, we get scared, we just lock you in the gym. We do very slow velocity-based movements where the actual sport specificity is very low. And then after about a period of 12 weeks, when we've completely deconditioned every other structure, we then let you go back out to play and ramp it up very quickly. So not only have you not built the confidence in actually you can move and you can expose that limb and muscle to high velocities, is that we've kept you away from it so long, your muscular tendinous junction is probably deconditioned or reduced in cross-sectional area, and other structures are now not re-exposed. So I think to overcome those fear avoidances, my approach to rehab is I bring drills in very early on and try to adopt, I guess, a speed-based approach to rehab. And I kind of bucket drills as high strain, as low strain, moderate strain, high strain drills. So it allows me to feed movement in across that whole process, and particularly focus on rapid hip extension, which is the deficit that we tend to see. But from a study perspective, yeah, I agree. I thought that for a while and thought, yeah, I should have put that data in right at the start.
Mm-hmm. Okay, well, that's just kind of something I from experience, just I wanted to ask you about, just because there is like that fear aspect of after, especially after you pull it, because I pulled mine like my right one probably 3 or 4 times.
Yeah.
You know, after you pull it once, you know, your first time you're like, okay, I'll get back to it, and then you pull it again, you're like, gosh dang it, like that fear of returning to that true top end speed kind of like creeps in a little bit. So
Yeah, I see it a lot. I mean, personally, even all my years of sprinting, I'd never had a hammy injury. But the people I used to train with would get a few and then would always get really fearful of certain sessions. And even when I've been in testing, um, or the rehab process with certain athletes, when it comes to sprint-based testing, I've had loads of people go, "Do you mind if I only just do 1 rep?" And then my second question is, "You've had a prior hammy, right?" And they go, "Yeah, yeah, yeah." I go, okay. I understand it. It's a really hard one, right? Because
Mhm.
in any sport specific context, for us to perform at the highest possible level, we have got to push that red line. And that red line is a very fine line between us performing well and breaking and getting injured and being on the sidelines again.
Mhm.
And like I've gone back round to, as a practitioner, I can't tell a single person where that red line is. Only individual athletes are capable of understanding where their limits are. Um, and that's the main difference that from what I've worked with people who won Olympic gold medals to people who haven't. And those often, I think those people who are on the, I think that difference between those people who are just on the fringes and just about don't make it, and those people who are like really successful, what you're doing physically and what you're doing training wise is often not that different. But the difference is that those people who are world class just know how to find and push their red line without breaking. We can't teach that. I think we've got to learn that inherently ourselves.
Mhm.
So it is very, very difficult in that rehab process. Like, you with your recurrent hamstring injuries, is like, I can't tell you when you can and can't push. The reality is only you can figure that one out.
Mhm. Yeah. True. Interesting.
Um, so we're kind of, I guess, to the end of what we had to ask, but one other thing I wanted to say was, are there any like other researchers in the sprint like field that we should keep an eye out for, like and stuff, and then also like resources that you're aware of that we may not know of that around sprinting?
Yeah, so I guess from a research-based perspective, I'm a huge big fan of Ken Clark's work. I think Ken Clark just and JB Morin, obviously, is someone I work closely with, and is a fantastic mind in this field. Yoda Mendeguchia is as well. He'll always produce something that's like pretty novel and different. So I like his stuff. Um, then who else have we got that? Actually, there's like there's a Welsh researcher called I can never pronounce his name and I've never met him. Neil Bezoidis, something like that. Um, like his work and some of his old stuff is absolutely gold. But just doesn't get like really well touted. Like I actually keep going back and coming across some of his stuff, and I'm like, this is amazing. Like he did one paper that looked at acceleration performance in the role of the ankle, and basically found like I guess ankles that don't deform when you plant on the ground and can resist that force and just generate higher angular velocities into plantar flexion was had a strong correlation with horizontal force production. And I'm like, oh, this is a gold paper that kind of goes, yeah, if we're running fast, don't neglect the ankle. So he's got some brilliant work. I think he's out of Cardiff Uni. Um, so they're researchers, and then resources. Resources is when it comes down to like applied practitioners, and I think what Altis do is produce some really good stuff. That's 100% where I'd go to, and even like I love and used to I always love Lauren Seagrave and some of his work from past, um, just like YouTube and Lauren Seagrave and seeing some of his drill based videos. And I've been fortunate over time to meet him and just pick his brains and stuff, which has been quite useful.
Okay, cool. And is that a combination of researchers that are kind of on the performance and the rehabilitation side?
Yeah, there's a mix. So Jurgen kind of sits more in rehabilitation side. I guess others in sprint-based rehabilitation. Wow, this is like quite a tough one. I don't think there's many that go in sprint-based rehabilitation now. Jurgen definitely does. Um, there's all the modeling work from the Aussie researchers like Marcus Pandy. Um, that's not necessarily rehab wise, but that's quite good stuff. Rehab wise, your neck of the woods, Brian Heidershit, however
Mhm.
you say his name. His is good rehab stuff. And then performance is pretty much like Neil Bezoidis from Canada and JB Morin and Ken Clark. They're very performance heavy.
Okay, cool. Anything else?
No.
So kind of final question.
Yeah,
So we're about to graduate here in May,
yeah,
and this video will be shared with our class.
yeah.
What advice would you give us as new grads as we go to become practicing clinicians and potentially working with, the running population? What advice would you give us?
Oh, right. There's quite a bit, right? So I always think back to when I first graduated. I guess one of the big things is never think you know everything, because just as you get confident with something, someone's going to come slap you in the face and take that confidence straight away. So always accept that. I guess the day you think you know everything is probably the day you need to quit, because we're all forever learning. And on the forever learning element, the biggest tip I could say is reach out to people to just pick their brains, speak to them, spend time shadowing and watching what they do to learn from others. Because that element of reaching out to others and just working with people can hopefully challenge your ideas and preconceived ideas that you had. It opens networks and doors for new opportunities, and it broadens your mind to various different ways of thinking, which I think is pivotal for going forward. We are all learning and we are all novices in one way, shape, or form. I mean, even now, like I still like to work with people who challenge me and help me learn something new. My biggest frustration is like, look, if I think I'm the smartest person in the wrong room, I'm definitely in. If I think I'm the smartest person in the room, I'm definitely in the wrong room. So
Okay,
yeah,
awesome. Well, thank you so much again for your time. We really appreciate it. Is it okay if we post this on YouTube?
yeah, more than happy
Okay.
for you to.
Okay, awesome. Cool. Well, yeah, again, thank you. A lot of great information. Hopefully we can take it and kind of implement it into practice.
Yeah,
So have a great rest of your day, and hopefully we kind of cross paths at some point soon.
yeah, you too, guys. Good luck with the
Yep.
rest of your studies.
Yep.
Thank
Thank
you.
you. See ya.
Thank you.